Okay, so now we talked about how you can expect labor to begin and progress, as well as vaginal versus cesarean births. But what if your labor doesn't progress in the way that we outlined? Or what if it doesn't get started on its own? In this case, you'll need an induction or augmentation of labor. Just the word induction sparks lots of controversy and opinions, and all of it depends on which study you read or what provider you discuss it with. In general terms, though, a labor induction is when labor is brought about with the use of medications or other interventions. Labor may be induced for a variety of reasons. First are health concerns. There are a variety of concerns that can result in induction, including preeclampsia, gestational diabetes, cholestasis, intrauterine growth restricted, decreased placental function, and decreased amniotic fluid level. Induction may also be considered if there is concern baby is too large or small for mom's size or build, or is growing rapidly. Next is a post-term pregnancy. Induction may be done if you are greater than 41 or 42 weeks pregnant. Also, ruptured membranes. If your water broke and your body has not started the labor process, you may need medications to help kick you into labor. Lastly is age. Studies have shown that patients over 35 at the time of delivery have an increased risk of complications, so your provider may determine to induce you. Or perhaps there aren't any medical concerns or risk factors. Perhaps you and your provider have picked a day and scheduled an induction. Elective inductions may come into play if you have advanced dilation, live far from the hospital, want to have your partner or a specific provider with you, or if there is a concern about emotional well-being. These inductions have become more popular, partly due to studies like the ARRIVE study, which found that first-time moms who were induced at 39 weeks had decreased rates of a cesarean from 22.2% to 18.6%. Now, let's talk a bit about the induction process. Some women, particularly those who are not effaced or dilated, begin their induction process with something called cervical ripening. Cervical ripening is a process that helps prepare the cervix for labor, helping it go from long and firm to short and soft. You may hear the short and soft cervix referred to as a ripe or favorable cervix, and your provider can actually measure how favorable your cervix is using something called a Bishop score. There are two main methods for cervical ripening. One uses medications, the other is done mechanically. For medications, we have prostaglandins, which can be given vaginally, buccally, meaning it dissolves inside the cheek, or orally. These are a natural hormone produced by the body that helps kickstart labor and effaces the cervix. Balloon catheters and dilators can also be used, and these mechanical methods have shown to have similar outcomes to prostaglandins. They can even be used together in some cases. The goal of both is to help the patient have a more favorable cervix so they can continue the induction process. With a ripe or favorable cervix, it's time to actually induce your labor. And like with cervical ripening, there are both medications and mechanical methods that can be used. For medications, there are several that can be given, the most common being Pitocin. Pitocin is a synthetic version of a natural hormone, oxytocin, which helps start, boost or encourage labor and contractions. Pitocin is given through an IV, started at a low dose, and increased slowly. And your contractions may take some time to start, especially if you're starting from scratch. When the contractions do kick in, many women describe them as more intense than if they were not given Pitocin. And studies do show you may be more likely to get an epidural if given Pitocin. Pitocin and other medications can also be given in conjunction with a mechanical method of induction, like AROM, or artificial rupture of membranes. This procedure is when your practitioner inserts a long plastic device called an amnihook into your vagina and punctures a hole in the amniotic sac. While the amnihook does look like a big crochet needle, no need to be nervous. The procedure is painless. You may notice a gush of water after the rupture, and then your contractions will start coming stronger and faster once it's done. AROM is done to boost labor if contractions aren't strong, frequent, or close together, and your labor has stalled, because breaking your water releases hormones that tell the body it's time to kick into labor. It also allows the baby's head to rest directly on the cervix to help it dilate faster. Membrane sweeping is a bit different from the other induction methods we just talked about, because it actually happens before you even reach the hospital or birthing center, and is generally performed during one of your prenatal visits. With membrane sweeping, a physician or midwife places their finger into the cervix and sweeps around the base of the amniotic sac. It can be uncomfortable and should really only be done once you are full term, since labor will usually start within 24 hours if the procedure has worked. Some moms opt to try this after the 39-week mark to try and kickstart their labor. While every situation is wildly different, for first-time moms dealing with an induction, I normally say they should expect the process to last for 24 to 36 hours. But of course, this depends on how ripe your cervix is to start and how your body responds to the medications and interventions. The induction process can be lengthy and exhausting, so you might find yourself wanting to reach for a comfort snack. Talk to your provider, since different providers have different comfort levels when it comes to eating during the induction process. Before we move on to how to manage your labor and birth, I do want to mention that while cesarean births and inductions are some common labor experiences, there are some rare delivery complications that may arise. If you aren't in the headspace to hear about them, I totally get that. Like I said, they are rare. If you do want to read more about them though, you can check out our takeaway all about it. You got this. There are so many great tips and techniques to help you cope with, and dare I say, even enjoy your labor and birthing process. Let's get started.